So good evening, we are live. Welcome to our 7th webinar on mental health. We are awaiting attendees to log in and then we will start off. So we kindly request a few minutes as we await for our Zoom attendees to attend. But we are live on Facebook. We urge you to share and ask your colleagues to join in. Today is a very important day. We are learning about loss and grief from Dr. Catherine Mutisia Siengo. She is a consultant psychiatrist, and we have an array of panelists who are specialists in psychology, clinical psychology, and psychiatry, and various other specialties who will be sharing about their experiences during this COVID period. We are honored also to have the Medical Students Association of Kenya president and the committee lead for mental health within the Medical Students Association of Kenya. And we look forward to hearing from them and sharing more about the experiences we are going through during these hard times. I welcome my co-host, Edith Kwoba, who will be hosting with me to say hello and welcome the guests who are arriving. Welcome, Edith, from Eldoret.
Joy, I hope everything is going on well for everyone, wherever they are. And like Joy said, we are looking forward to having a very productive evening. Just sharing, I'm sure many of us have gone through grief in one way or the other. And of course, as healthcare workers, sometimes we experience grief in the sense that we have to tell people that people have died, their relatives, and we grieve in one way or the other. And sometimes we don't know how to handle it for them and for ourselves. So we are looking forward to the great speakers just sharing with us how to be better people going on to handle grief. Because I think, as a matter of fact, for everyone who's been born, there'll be some death. And the problem is how we handle it. And we are looking forward. I hope everyone just sit comfortably to learn together with us. Thank you. And then to just start us off will be Dr. Mugambi, just making sure that all of us are on the same page on the housekeeping rules. Dr. Joy, for those who don't know, family physician in Ravine. She calls herself from Nakuru, but I know she really works in Ravine. Joy.
Thank you, Kwoba. We've got 2 more minutes to 6:30 we start off, so we'll give attendees time to log on.
I think that's fine.
Who will be hosting with me? Say hello. Thank you. So good evening. Welcome all to our session today. This is our 7th session in terms of webinars to deal with mental health. This is brought to you by a partnership between Kenya Medical Association, Kenya Psychiatric Association, and CPAK. I am Dr. Mugambi, the Assistant Secretary General, Kenya Medical Association, and part of the Physician Wellness Committee of KMA. Today we'll be sharing about loss and grief during COVID-19 pandemic, not all about the lives lost, but also the loss of social economic, the loss of our economy in terms of work, in terms of even just the livelihood that you have been carrying out wherever you are. We have Dr. Catherine Siengo, who will be presenting today. We have an area of panelists, Dr. Liz Ahemba, Professor Lukoya Atwoli, Rachel Maina, Yvonne Orlando, and Eva Nyaga. We have also panelists who will be sharing their experiences from MSAKE, the Medical Students Association of Kenya. We also have general practitioners, we have obstetricians with us and a pediatrician with us, and they'll be talking about their experiences within this COVID time. I want to share a bit about this platform, the Zoom platform, so that our audience on the other end can be able to chat with us. There is the chat button at the bottom there. You can click onto it, and once you click onto it, it will log you into this page. On that page, you can type in your message down there, and this will be able to be accessed by our panelists. But this is if you're handling an individual message to a panelist. But if you do have a question, use the Q&A platform on your left, on your right, and be able to access it. And this is how it will look. And you can put down your question, and this will either be answered live or you will be answered directly by one of our panelists or speakers. We have been here for 6 other sessions. This is our 7th session, and these resources can be found within our Facebook page or in our resource page within our website. If you need any help, you can reach out through this number and you'll be linked to either a psychiatrist or a psychologist to help you during this hard time. This is for health workers between 8 and 5 o'clock. Thank you. I hand over to Edith Goba to introduce our speaker, to introduce our chair for the Physician Wellness Committee, and the president, KMA, to welcome our speaker.
Thank you very much. As Joy has said, this webinar is hosted by Kenya Medical Association, Kenya Psychiatric Association, and the Clinical Psychologists Association of Kenya. And in Kenya Medical Association, we have the Wellness Committee, and Dr. Somba happens to be the chair of that committee. So we always want to have him with us. So Dr. Somba, just give us a welcome.
Well, thank you very much. Good evening. Can you hear me? Hello?
Yes, we
Hello.
can hear.
Oh, yeah, okay. Thank you very much, everyone, Joy and the team. First, I want to say thank you very much, even to the participants who got time to join us in this webinar. And I'd like to welcome all of them, and I'm sure we'll learn a lot today. Of course, our topic is very, very relevant, loss and grief. As we work in the health, this seems to be the in thing all the time. You know, people are dying and we don't know how to go about it. And sometimes people think that doctors don't grieve and don't cry about this issue. But I think I think will bear witness me that we actually feel a lot of pain. So I think the topic is relevant, and especially with this during COVID-19 pandemic. I am sure Dr. Catherine Siengo will do justice to this topic. And I just want to remind everybody that our committee assists all doctors anytime, anywhere, anyhow. And I'm pleased to hear that the medical students in this seminar, please welcome and feel at home, and know you have mentors So you're not alone. And I want to say that in the committee, we always ask people not to feel lost, not feel alone, and not feel lonely. And we are there to provide a shoulder to everyone, health doctor, to lean on, and also empathize with you. And please go the number, call upon us if you need any assistance, and feel free to get in touch with us. For those few comments, I'd like to welcome everybody, and let us sit and wait for Catherine to lead us in this talk. Thank you very much. Karibuni sana nyote.
Thank you very much, Dr. Somba. We really appreciate those comments. And now I want to invite our president, the president of Kenya Medical Association, Dr. Kitulu, to give us a word and welcome us into this webinar.
Good evening, everyone. I'm just getting home, so I'm still masked. But thank you very much, Dr. Koba. Thank you, Dr. Joy. Thank you, Dr. Somba, for really organizing these sessions. Last week, I happened to be on a webinar with the Shanghai group, the team that were treating the Wuhan cases. And one of the most critical pillars they had was the psychosocial support, specifically for healthcare workers. So clearly we are on the right track, even as we ponder all these various mental health issues and matters that require psychosocial support for healthcare workers. So good job, team, and let's keep on sharing widely. As I keep on saying, these sessions are enjoyed by many beyond our borders, and let's continue supporting each other. Thank you.
Thank you very much, our president, for those wise words. And for those who just joined in, just to remind us that we're going to have a very interesting discussion. Well, the topic may not be interesting, but we'll make sure that we feel better at the end of it. We have a number of panelists. We have Dr. Kigondu, an obstetrician from Muranga. We have Dr. Super Tunje, a pediatrician from Machakos. We have good old Professor Lukoya Tuoli, psychiatrist from Eldoret. Well, he told me now he's in the city, but he still belongs to us in Eldoret. Then we have the Kenya Medical Association of Kenya President, Nicholas Kioko. Interesting to have even our young ones with us. Rachel Maina, a psychologist in Nairobi. Itau Catherine, psychiatrist in Nairobi. Yvonne Orlando, psychologist. And we have the Medical Associations of Kenya Mental Health Committee lead, Gloria Boari. And we are looking forward to the discussions. You can see from the list of panelists that is going to be exciting. And now to bring us to the main presentation is one Dr. Catherine Siengo Mutisia, and she's my teacher. That's where I want to start. When I rotated in Madane some years back, she taught me psychiatry in Ward 5. And other than that, she's one of the leading psychiatrists in Kenya. She currently works at the Ministry of Health and Madare Mental Hospital. She previously has headed the substance use department at the Ministry of Health. You'll be interested to know that she loves family. She actually heads the Nairobi Mental Health Clinic and a parenting clinic and does a lot of family therapies. And again, another interesting thing about my teacher is that in 2014, she was named as one of the top 40 under 40. At that time, she was the deputy master for Madare Mental Hospital. And we look forward to this exciting discussion. Dr. Siengo Mutisia, I would like to welcome you to share with us what you have for the evening.
Thank you very much, Dr. Edith. I hope everybody can hear me. Good evening, everyone.
I can hear you.
Yes. Joy, the slides. The slides.
You can share, Catherine. Dr. You can share on your end.
Okay. You're able to run them from that side? Oh, now finally I've found them. Okay. So good evening, everyone. Today we are discussing loss and grief, especially during this pandemic. And we all know that as long as you are alive, you will never avoid losses. And we are all dealing with the collective loss of the world we knew. We knew it to be. Many things have changed. We've just seen our chair coming in with a mask into the house. So several things have changed. And grief is a natural response to losing someone or something that is important. It is a reflection of what we love. And for all doctors and even the medical students, it's important to remember that grief is a normal phenomenon common to all of us. And as we go through life, we experience a wide variety of losses from which we will, at one point or the other, grieve. It is not possible to go through life without suffering losses. I doubt whether if you lived, you would live full life without ever suffering a loss. Now, we know that in this period, we are all going through experiencing various concerns, just like the general population. But we know that as healthcare workers, many of us are on the front line. And in addition to what the general population is facing, we are also facing a lot of other challenges. We know that many of us, especially the young doctors and the senior doctors, we know that there are some hospitals where they've given some healthcare workers leave, some paid leave or reduced on increased the number of hours worked. We know that there are some young doctors and healthcare workers who have been surviving on locum because they have their full permanent employment. So we know that there's income and losses, and those who are in private practice, definitely their income has been affected. That comes with financial anxiety. We all walk around feeling not safe as we used to be. That is loss of safety. We worry about our loved ones just like everybody else. And this social distancing, quarantine, and feelings of isolation. I think for healthcare workers, it is real. When you imagine that in your course of work, you could actually be in contact with somebody who is positive for the COVID disease, and you imagine that from your work that your family, the people you work with, your colleagues, could actually end up in a quarantine. And I think this is an ongoing problem facing all healthcare workers. Of course, there's changes in daily habits and routines for the general public and even for us as healthcare workers. And special plans. We were just chatting with Gloria before we started the Zoom, the meeting, that there are medical students who have been studying for a very long period. Special plans of graduation and eventually becoming independent are still being held. We know that because we are part of the general populations, people have had to reorganize or even postpone weddings. Funerals are no longer what we knew them to be. So many things have changed. And as we interact with our family members, of course, there is a general concern of whether each family member is protecting themselves and whether they could bring disease to the family. And for the healthcare workers, for us, because our families know that when we go out, we are going to interact with patients, that could actually be a source of concern for the family. Worries about how to pay utilities and other bills, rent for some people, and sadness over how the pandemic will affect the whole world, and fears for the future. So these are general concerns for everybody. But when it comes specifically to healthcare workers, because this webinar is targeting healthcare workers, we know that we are all concerned about personal protection. The equipment for personal equipment protection is not widely and adequately available. And this has been a specific concern for frontline healthcare workers and healthcare workers generally. Fear of getting infected and affecting our loved ones continues being with us, having to be a frontline worker and the dangers associated with it, and interruptions in medical practice as we knew it. We know that you wake up one day and you discover the career you have put all your energy in. And the only way you knew of making, most of your income, suddenly it appears that it is quite dangerous and that you have to rethink how to do it. That has been a major loss, specifically for healthcare providers. Schools and colleges are closed. Our children and young adults are with us. And we had to change our schedule. We knew at what point they were going to be in school, at what point they were going to close. Many of us planned for holidays, how to handle our children. That is not happening. So that is a major concern for healthcare workers, and especially because healthcare workers have to work. We know many of the other colleagues who are not in healthcare work, and the urgent services are being told to stay at home. So everybody else is being told to stay at home, and healthcare workers are being told to go to work. And our children are also getting confused because their friends tell them their parents are at home, and for healthcare workers, we still have to go to work. So those are the specific problems being experienced by healthcare workers. Businesses and unemployment is also affecting us. And what is important when it comes to loss and grief is because one loss, you could be able to stand one loss, but sadly, we find that these losses we've discussed, the change of medical practice as we know it, the change of livelihood as we know it, walking around wearing a mask the whole day. Some of us have tried the N95 and we can't stay with it for very long because it's quite uncomfortable, especially for disciplines like psychiatry, where we were used to not wearing masks. So this might come when you're experiencing other losses, and we'll be seeing why is it that several people will experience the pandemic, but some will be affected more than others. So as this comes in, some of us could be experiencing death of a loved one, and we know some healthcare workers have lost loved ones in this period, very close family members. Some of us could be experiencing end of a relationship, loss of a job, or probably you had decided to venture into private practice at that time or into business. Life changes, like you've at a point where your children are leaving home or you are moved houses. You probably have had diagnosis of a chronic illness, having moved to a new home or a new business. These are some of the things which some of us could have been having in addition to the stress brought about by this pandemic. Issues like retirement, there are adjustments, loss of a cherished dream. You could have had a dream which has just died off, and then the uncertainties of this pandemic find you when you're already having losses. You might have had a loved one been diagnosed to have a serious illness, loss of safety after trauma, things like even to some people, death of a pet. So as we look at all these losses, we need to remember that it might not just be what we are facing, all of us. Some of us might have been having ongoing losses. And so when you're faced with what we are seeing with COVID-19, then you find that some people will be affected more than others. Various emotions may be experienced as one comes to terms with any loss. Remember, when we talk of grief and we talk of loss and grief is not just for having lost a loved one. Something you love, losing something you love can actually make you experience grief. And it is very important that each one of us is able to realize the reasons behind their feelings. So even as we all go through various emotions and feelings during COVID time, we need to stop back and say, look, are there any other losses I need to deal with? Is there a specific loss I need to accept this COVID time? Like, for example, no one knows how it will end. No one knows. I know in Kenya now we are wondering, are we opening up? The numbers are still increasing. So there's a lot of uncertainty which we can't determine. And so as healthcare workers and everybody else who is listening to this discussion, as we go through various emotions, take time and stop and analyze. Is there a loss I'm dealing with, which I may need to deal with and accept and look for help about it? And we know that when you're going through grief, unexpected emotions could be experienced. Things like shock, anger, disbelief, guilt, sadness, regret, sometimes even blaming yourself for things you're not responsible for. A lot of fears, loneliness, depersonalization, feeling overwhelmed, lack of sleep. And also in some people, their appetite will be affected. And sometimes as healthcare workers, we know there's depression, there's anxiety. Sometimes you could start thinking you're really suffering from depression or anxiety disorder when you're actually going through uncomplicated grief. As we discussed, we'll see, we have uncomplicated grief, we have complicated grief, and you can also have depression and even PTSD, post-traumatic stress disorder, resulting from grief. And a person may attempt to avoid reminders of a control stimuli, which can interfere with the normal grief progression. These are all normal reactions to loss. And the more significant the loss, the more intense the grief will be. So we will have all lost, we are all going through various losses. Some have multiple losses. Some of us are just dealing with what COVID is bringing us. And even COVID is affecting us as healthcare differently based on our personality, what we might have gone through in our childhood and various other things. And we know that while uncomplicated grief may be extremely painful, disruptive, and consuming, it is usually tolerable and self-limiting. And uncomplicated grief will not require formal treatment. But like I had said earlier, we need to actually be able to note that we are going through a loss, we are going through a grief, and whenever an emotion occurs, we are able to tell what could be triggering it and not avoid the stimuli. I've mentioned uncomplicated grief, which is self-limiting. And we know that many people, when we were training as medical students, we were told the stages of grief and all the way up to acceptance. And we are now seeing that from research that grief might not necessarily follow through all those stages. And we know that grief specialists recognize the variations and fluidity of grief experiences that differ in intensity and length among cultural groups and from person to person. Don't sit and wait and say, I'm angry, I will move to denial, I will move to acceptance. For you, it might not follow those specific stages. And we know some people will tend to have bouts, like in a day you might spend some hours feeling okay, and a trigger occurs and it reminds you, and all of a sudden your emotions change. So it would be good to realize that the stages as we knew them, they might not necessarily follow that. And it is very key to differentiate, because the treatment is actually different. We've said uncomplicated grief does not need treatment. It is self-limiting. So we need to be able to differentiate between uncomplicated grief, which we self-limiting. We need to differentiate it from depression. We know that there are some shared characteristics. So like if we look at uncomplicated grief, you will have various moods shifting between anger, sadness, normal states in one day. So somebody will look at you and at some point they'll find you're okay. And then at some point your moods change. And a layman will look at you and say, the way they use the word bipolar, are you bipolar? Sometimes you are happy, then your mood changes, you become sad. Of course, I'm not using the term bipolar the way we know it medically. I'm just trying to show that you seem to have states of normal mood, then other days, other hours of the day, your mood changes. And the person will be seen to be preoccupied with the loss. And remember, I've said that the loss we are talking about is not necessarily just loss of a loved one. It could be loss of something you dearly love, changes in your life, and the difference between grief and sadness. This person will respond to warmth and reassurance from others. So if I'm concerned about my finances, and probably you sit with a family member and you have a discussion, are you really having a financial challenge? And you go through your finances and you discover you're actually not in danger. You don't need to fly or fight. You remember, whenever we are scared, we release adrenaline to prepare ourselves to fly or to fight. So when you discuss the issues you are dealing with, you discover that with reassurance from loved ones and friends and analyzing the situation. And that's why I said you need to actually stop and say, am I feeling this just because of COVID? Or is there a specific loss I'm worried about? And if it is, do I need to journal down? Do I need to do a golden thread and find out why am I feeling this? Is it true that I actually have a financial problem or not? Is it true that I'm actually not safe when I'm working, even though I'm wearing the protection needed, even if I'm wearing my mask, I'm washing my hands, and I'm eating? And the person with uncomplicated grief will stay connected with family and friends, as opposed to depression. Somebody who is going through depression will be immobilized, will most of the time want to withdraw, and we will actually be feeling overwhelming guilt, and it is persistent. There won't be shifts of some hours you're happy, some other times you're anxious, some other times you're feeling sad. And somebody who is going through depression will be preoccupied with negative, distorted self-view, and they are unable to feel comfortable by support of others. So as opposed to a complicated grief, when you talk to loved ones, family and friends, when you're going through depression, the feeling might not go away, but uncomplicated grief might resolve when you analyze the issues you're dealing with. Let's look at what is shared on my right. There are some characteristics which are shared between grief and depression. You might have sadness, fatigue, which is the same as loss of energy, inability to focus, loss of interest. There's anxiety, somatic disturbances. Some people might even have loose motions, anger outbursts, fear of losing one's mind. Spiritual, you start wondering and questioning your beliefs, spiritual beliefs. In relationships, how you relate with other people, impaired physiological functioning, like we've talked about appetite, sleep, and longing for the end of pain. Even those who are going through uncomplicated grief, they reach a point they wish the problem will go away and wonder when it will eventually go away. How do we handle uncomplicated grief, even as we go to depression and complicated grief? Because we know that majority of the population are fearing, including healthcare providers, are afraid to go to hospitals. Many people think that COVID is in the hospitals. So even when they're getting complicated grief, when they start getting depression, they might not visit or talk to a mental health provider as much as help can even be found online. They might come to us when they have already having depression, or even having post-traumatic stress disorder, or they're even having complicated grief. So when we are talking of uncomplicated grief, how do we deal with it? And of course, the panelists will also be giving practical solutions on how to handle uncomplicated grief. Find a way to pick up the pieces and move on. And that's why I said, let's stop and question the feelings we are having and the emotions we are having. Could it be something you've lost, which you need to analyze whether it's actually an actual loss or an imagined loss? Could it be that you need to accept that you have lost that particular thing and you need to move on? So we need to find out what is it that we are losing, or we think we have lost. And we've mentioned there are various things we could be dealing with, not just necessarily loss of a loved one, although that is also very key. We know healthcare workers have lost their loved ones. So find a way to pick up the pieces after you found out what is it that you've lost. Acknowledge your pain. We've said that the grief pain is real. As much as it might not need treatment, it is real. Accept that grief can trigger many different unexpected emotions. And some people will look at you and think you're causing drama. But for you, you know, these emotions are just coming, they seem to be changing. Understand that the process will be unique to you. And don't compare yourself to others and wonder, why is it that I'm the only one who is feeling this way and colleagues are not feeling this way? Why is it that in my family, I'm the only one who is feeling this way? Understand that we all process things differently, and we'll be looking at why is it that people are processing things differently. Seek out face-to-face support. It's unfortunate that we are also encouraged to have social distancing. Those of us who are privileged to be living with a family, talk to your family members. And even if your family members are far, call them and talk to them, do video call, Zoom with them, discuss with them what you're going through. Support yourself emotionally by doing self-care. I know the other day Edith had talked to us about self-care. Recognize the difference between grief and depression. And sometimes, even as healthcare workers, we are not able to tell. And remember that bereavement does not immunize the patient against a depressive episode. And that's why it's key to know, are we actually dealing with uncomplicated grief, or have we reached depression? And we also know that grief is a common precipitant of clinical depression. And recognizing major depression in the context of a recent bereavement takes careful clinical judgment. We've said that complicated grief occurs in about 10% of the bereaved people or people going through losses. And we've said that with uncomplicated grief, we don't need to manage it. We just need to realize what we are going through and talk to family, friends, clergy, and be able to deal with it and have self-care. Take breaks when we need to take breaks. And complicated grief will occur when there is failure to transition from acute to integrated grief. And as a result, acute grief is prolonged and perhaps indefinitely if there is no intervention. And we can't pretend that healthcare workers are just dealing with the general losses that we have several healthcare workers who have lost loved ones. And we also need to talk about symptoms related to death of a loved one. There might be separation distress, which is basically you get painful emotions with intense yearning and longing for the deceased, and preoccupation with thoughts of the loved one. There's also what we call traumatic stress, which is a sense of disbelief regarding the death of the person, and anger and bitterness. And we also have pronounced avoidance of reminders of the painful loss. So somebody could decide, I do not want to think about it. I don't want to think about that person. I don't want to see anything, everything related to that person. No reminders, don't ask me about it. That could be a pointer that the grief might be progressing to the complicated grief. Both complicated grief and related major depression can be persistent and gravely disabling, and they can interfere with function and quality of life, and may even be life-threatening. We've had people who have committed suicide, and we know that they will also, if unchecked, will also bring in other physical complications like hypertension, like diabetes, like eczema, and many other physical complications. And we know that complicated grief and major depression related to grief can also will respond to targeted interventions. And just to remind those who might have missed out that complicated grief is basically prolonged and intense, associated with substantial impairment in work, health, and social functioning. So your work is affected, your social life is affected, and physical functioning, like even appetite, sleep, simple things like having to take care of yourself, wake up, shower, brush your teeth, physical impairment. And there is also something called anticipatory grief, which occurs before a loss, and many healthcare is when we knew Corona was in the country, and initially we did not know that we had protective equipment, and they are still not adequate in many places, and many healthcare workers suffered from that. You anticipate grief and before you get the losses. And in the backdrop of this COVID-19, we know there is fear about the short-term and long-term impact of the pandemic, and this is contributing to feelings of grief and anxiety. We've said with uncomplicated grief, monitor progress in adapting in order to make categorical decisions about whether or not to intervene. So monitor whether the person's physical health is getting affected, because like if you're not eating, then you are in danger of eating and drinking, you're in danger of getting dehydrated, you're not sleeping, you're not taking care of yourself, you're not able to exercise, you're not able to talk to your loved ones. We monitor and see whether we need to intervene. We had mentioned that some people are more predisposed to get into complicated grief and even depression, because we are all different, and that's why I don't compare yourself. If you feel that you're getting overwhelmed, seek help from a mental health provider. Some things like individual pre-existing personality, we are all different personalities. Attachment styles, especially depending on what we went through childhood, our genetic makeup, unique vulnerability. These are individual things which might make us respond to loss and grief differently. Of course, age and health, our spirituality. People who are spiritual tend to handle grief. They can explain that there is life after death, and they have a way of conceptualizing that. So depending on how spiritual you are, you might find you're more affected than other people. Cultural identity, supports, and resources. So social support, very important. And depending on how strong your social support is, then you could find that you're getting more affected more than other people. There's something I said from the beginning, COVID-19 has found some of us going through losses already. And the number of losses you had compared to somebody who is just related to COVID-19. So people who have had previous losses in their life will tend are predisposed to move into complicated grief, and eventually some would even end up getting depressed. Nature of the relationship of the person you've lost in case of bereavement of a loved one. If you are very close, depending how close the relationship was, or even in some cases, if you had not resolved issues with the person, the intensity of the mourning process could be intense and make you predisposed to complicated grief. Type of loss, for example, sudden versus when you've watched somebody been sick with a chronic illness, sudden loss, which seems to be what we are seeing with COVID-19, could actually predispose one to tend towards complicated grief and in some cases depression. So those are some of the things which will make different people respond differently to the grief and losses we are facing. We know that positive feelings 6 months following a death or a sign of resilience or a loss in this case. 6 months later, if you have positive feelings and is a sign of resilience, bouncing back, and associated with good long-term outcomes. Remember, we said with uncomplicated grief, we monitor and make sure that it doesn't end up getting into complicated grief or even depression. Management, I know we have panelists with us. We are going to discuss further. We know that we need to have empathic support and information that validates that the response we are having, the emotions we are facing are valid. Remember, I said that one person could look at what you've lost. Think, for example, you're a doctor, you have a salary. What is it that you've lost? To you, you might be dealing with specific aspects of the loss. And if the feelings are there, you really need to evaluate what is it that is causing these emotions and deal with it specifically. But remember that the feelings are valid and you need to identify what is causing them, the specific loss, because we are dealing with so many losses related to COVID disease, and other people could have had ongoing losses, and even now people are also having ongoing losses. We know that rates of domestic violence, as discussed in the last CME, are increasing. That means relationships are getting lost or affected. So there's ongoing loss. We know as part of the management, the reassurance and information generally provided by family, friends, and clergy, especially when we're dealing with bereavement or loss of a loved one, could actually be very helpful. Mutual support groups, very helpful. It has been shown that support groups of people who have gone through loss is very helpful. But with COVID, again, there is social distancing. So some support groups have gone online. And you can find even international groups online if you are not able to access physical support groups. It is still not grief person can develop complicated grief while another suffers from major depression or post-traumatic disorder in wake of a loss. So again, don't blame yourself. What you're through ends up being complicated or major depressive episode. We can't even tell why some people will get complicated grief and others will get depression, and some people will even get post-traumatic disorder. When it comes to complicated grief, we need to intervene, and we are to monitor uncomplicated grief to be sure that it's not getting into complicated grief. When we've already diagnosed that we need to intervene, there's a combination of cognitive therapy techniques with aspects of interpersonal psychotherapy and motivational intervention. So like cognitive behavior, we will be looking at, some people will blame themselves and say, if only I was around, my love would not have died. If only I had called my loved one at this point, probably they would not have died. So when it comes to cognitive behavioral therapy, questioning some of those thoughts, and also motivation or interviewing, like seeing on what is that you want in life, and again, even asking yourself, if this person I'm grieving or I've lost, whatever it is, depending on your belief, what would they want from me? Would they want me to be miserable? Would they want me to pick up and move on? What is it that they would want? So some of those engagement can actually help somebody be able to resolve complicated grief. Focusing on coming to terms with the loss and on finding a pathway to restoration. Again, I said that identify what specific loss are you dealing with, and once you have identified it, see what is it that you can do, and focus on a pathway to restoration. If it's financial difficulties, how can you deal with it? If it's loss of a job, how can you deal with it? If it's the fact that we're dealing with a situation we can't control, how do you deal with it? So focus on identifying the specific loss. And in life, we have to learn that there are some things we can't change and we have to accept them. And structured exercises, focusing on repeatedly revisiting the time of death, especially for those who are grieved and dealing with grief from loss of a loved one. When people with complicated grief are helped to deal with, to analyze the situation from the time of death, the activities they did after that, the situations they have had to deal with, moving a person, especially the ones who have been avoiding, through that as a structured exercise could actually help them start dealing, resolving the complicated grief. Focusing on personal goals can actually make you want to start living and focusing on your life again, and remembering that if it's a loved one, they would want you to move on with your life. In conclusion, I would want to say that if you have not personally experienced a death related to the pandemic, don't dismiss what you're feeling. That again, I emphasize loss and grief is not necessarily just as a result of loss of a loved one. You could actually be dealing with grief from the various losses you've experienced, and it could even be a reminder of previous losses. So it would be good if you see that your emotions and feelings are not stable, analyze and see whether you're actually in your grieving. It is important to engage in, it is important not to engage in comparison of losses and say, some other people have lost more than me. Some people don't know where to get their next meal. And so I shouldn't be feeling this way. So we all, like we've said, because of various changes and our personalities and what we've gone through and our social support, some people could be more predisposed to grief and associated complications. You may not have lost a loved one, but the losses you're experiencing now are valid and legitimate, and treat bereavement-related major depression as treating depression related to other life events or non-psychosocial precipitants. As doctors and mental health providers, sometimes we could dismiss that no more grief and it will go away, when actually the person has gone into complicated grief or they're actually depressed. And once you diagnose depression, even in the background of a loss, even bereavement of a loved one, it would be very important to treat it. I'd promised Joy that we will do a very short presentation so that we can allow for live discussions and for the other panelists to also give in their inputs. Thank you.
Thank you very much, Catherine. That was very enlightening. And it's really derived a lot of discussions in the Q&A. Though before we start with the Q&A platform, would like to hear something from the clinical psychologists, Dr. Yvonne, Eva, and the team. What psychotherapies are there? Yes, we've had grief and the processes that are there in terms of grief, what I would be feeling in case I am grieving, but who do I seek help from first? Do I, we are all afraid of being told we are having mental ill health, but we need to seek help somewhere. And who do we seek help from? So the clinical psychologists, I give you the floor. Do take us through the psychotherapies that are available.
Okay, thank you, Joy. Thank you, Dr. Siengo. That was a very insightful presentation. Just to respond to what Dr. Joy has asked, first of all, we do not classify grief as a disorder. It is a very serious concern, but the DSM doesn't classify it as a disorder. And that's why we follow it keenly before it develops into depression, as Dr. Siengo mentioned. Now, most of the time we will follow the Kubler-Ross stages, where we will focus on, is the person in denial? Like there are people who have lost their jobs, and even their nurses in a hospital I know who have been given leave for 4 months because patients reduced, therefore they're not able to work. But someone is not able to accept that. So they do not have an income that will be coming in, but they're not able to change and sort of restructure their lifestyle. Then it comes to the anger part, where someone is worried about, why me? You know, I went to school, I worked hard, I have tried all this. Why me? Why not the other person? So you'll also work with the clients on that so that they manage their anger and the process, the whole thing. Then they move to bargaining, where you start praying. Every now you're praying for a miracle, you know, God, if you do this to me, I will serve you. I will tithe more than 10%. I will do all this. So you're bargaining with God. Then there's the depression part that is very critical, where we have to really focus on it to find out, do you need medication? Is it becoming complicated, as Dr. Siengo said? Where are you at? Then finally, there's the acceptance, where you accept this is where I am, and therefore I need to maybe take another step. Now, there is a psychologist, J.W. Warden, who talked about tasks that we need to look at during morning. And for him, he said, one, we need to really listen to the story of the person. You cannot do any intervention or any therapeutic practice if you do not have the story. That retelling of the story by itself is therapeutic. Now, the way you will be probing matters. If you probe anyhowly, you might actually cause more damage. Then, of course, once the person has been able to tell their story, we'll want to assess what happened before and things like that. Then we have to recognize that what they're going through emotionally is actually normal. People grieve, you have lost something. Then we also have to distinguish between grief and trauma. Something that has come to mind is we have cases like the nurse who were told left Nairobi and smuggled herself to see a partner. And people were taking it so lightly, not recognizing that that separation for her was actually loss. And that's why she had to go to the extra extent. And everyone was like, you're a healthcare provider, you should know better. Not understanding that this person is actually sick. In our forum, CPAC, we had a case where we were doing supervision for one of us who is handling a doctor who right now, when they're experiencing anything positive, they feel guilty because they've been seeing a lot of death and severe illnesses. So they are not able to appreciate this. And that is a loss by itself. So we need to normalize these emotions for this doctor. And at the same time, we need to stabilize them because we do not want the doctor to get to a point where they are guilty about life. There are those who go through guilt. You've lost your clinician and your parent has died, and you're feeling guilty because you're not there to take care of them. So we will work on that way. If I finish, allow me to say that with different individuals, we will offer different therapeutic support. There are those who will even involve rituals, like the rituals to commiserate. There are those who they can, light a candle for that person. They will feel better. Yeah. There are those who their ritual is writing it or drawing it or screaming about it. They will feel better. So there's no one particular therapy for everyone. Individual cases are handled particularly. Thank you.
Thank you very much, Yvonne. That was very enlightening. Do we have Eva also with us? Probably you can share something from the clinical psychologists as we prepare to take a question or two in collaboration with my co-host, Dr. Edith. Eva, as we await Eva to prepare herself for questions, we've got a question here. Not really a question, it's more of a comment. And I think this also needs to be taken seriously because it's actually causing us more grief and more pain and taking us at a loss. There is Patel who says, personally, I think we have too much media issues, and this is what is causing the personal loss. And this was retaliated also by someone else who says, yes, I agree with Dr. Patel, media, social and commercial are playing a major role in fear-mongering and sensationalization and can cause severe anxiety and even panic reactions. To Dr. Catherine Siengo and also Yvonne and the team from the Clinical Psychologists Association, how do we cope with all this social media news that's coming in, and also the news? I always see people in a rush to see the updates of the numbers, but on my side, I know there is also many other people who are dying of TB, who are dying of road accidents. How do we stop updating ourselves on a constant and driving ourselves through this grief of media?
Oh, do I start?
Yes.
You're very right that too much information overload can actually traumatize people further. We've reached a point where, like in our country, we get to hear about the numbers. They're increasing, but we do not understand what that means. And I tell people, if you already know what you need to do, you already know that you need to distance, physical distance. You already know that you need to wash your hands, you need to sanitize, you need to wear a mask. And for healthcare workers, they know what protective equipment they need to be in, depending on how close they are to the person. So this information every day and getting the news every day. Children are at home, schools are closed and colleges are closed. So you already know the information you need to know. So you need to know yourself that if you feel this is very stressful, you don't even have to hear the news every day. I can see Prof is ready to give his input. Thank you.
Prof.
No, I was saying you just continue. What I was probably going to say is that it's very important for people to realize that repeated exposure and continuous exposure to distressing information can cause problems for them. And so as far as COVID-19 is concerned, what we would advise is that somebody paces their access to information. So you could decide that you'd be getting updates once a day, the way the ministry gives the updates once a day. And that's when you get your updates. And then after that, you don't look at anything COVID related. You continue with the other things. If you're a health worker, obviously at the workplace, you're already extremely exposed. You don't need any more exposure. So following that approach then helps you to plan your life and to organize your other activities without necessarily focusing too much on these numbers that are rising. We know that they will continue rising. We know there will be more cases. We know people will be exposed. And our worrying and focusing on it doesn't change that fact. So organizing our lives in such a way that we are not overly invested in those updates and numbers would be useful in reducing the distress. So don't blame the media. It is us now to ration our access to that media, because the media will do what the media does. But ourselves, we can ration how much consumption we take of that media products.
Thank you very much. Actually, I once listened to one of the webinars from the Chinese team, and they actually said they looked at the data, and the reason why mental health issues were on the rise is because of the negative media perspective that was going on within the social media, within the television. So they tried to ensure that even from the hospital aspect and also from the healthcare side, that they, inclusive of all these messages of prevention and promotion, they also shared some positive messages on a daily basis that helped the clients also cope up and do much better, and also the health workers, giving something positive on a daily basis that would help them feel much better. So yes, we've got also another question here from anonymous attendee. How can we address issues of reduced salaries like 30% in hospitals, which have only NHIF as a backbone, of which there is delayed injecting money? So I think this is a question which has been repeated over and over again. I know people are going through a lot. There are people who have taken half pay. There are people who have taken no pay for the next 3 months. How do people cope? Yes, and health workers, we are not taught any alternative income generating activity other than to treat. So I throw it back to Catherine, Prof. In our clinical psychology team.
Yeah, I think one thing that we have to realize is that almost everyone will be affected one way or another during this COVID-19 pandemic. Whether you're a business person, whether you're a health worker, whether you are a Juakali artisan, everybody is going to be affected one way or another because either of the pandemic itself or of the control measures that limit your ability to access socioeconomic opportunities. So that's going to happen. How we deal with it, I mean, everybody has their own coping mechanism, and I do not think any one of us has the ability to advise people on how to make money and so on. But the key thing is to plan your life with the realization that your ability to earn an income is going to be restricted over the coming months. And so whatever you do to deal with situations of scarcity, this is perhaps a time for you to plan around those times of scarcity. If you can save something, this is the time to work on that. If you are lucky to have opportunities to invest and to make a little bit of money, this is the time for you to do that. But then realize that this is not a normal time. This is a time of scarcity. And whatever philosophy you have had all through your life for dealing with times of scarcity, this is the time to deploy it and to work through it. And if you plan, you have less anxiety. If it comes upon you suddenly, then you have a lot more anxiety, and then you will need support from mental health professionals to help you cope with that distress. That's how I look at it.
Thank you. Any other suggestions from the team on how to cope up? Thank you very much, Prof. It's true. We need to remodify our practices, reduce our costs in terms of whatever you are spending, if it was very expensive, and start saving, start investing on smaller, cheaper things, and be able to tide over. So there is a question here. Someone is asking, they've noted that people have suddenly loosened in their ways of practice in terms of putting on masks, hand washing. This act may raise in case we open that. So that's more of a comment, but I know we'll have deliberations on, well, memory is short and most people do forget what they were supposed to do. But someone here is worried that once things open out, there'll be an increase and a surge of cases and death. There is a question here from Irene Olo. Kindly expound on somatic disturbance experienced during both uncomplicated grief and depression. I forward this to Dr. Siengo.
Thank you very much. We could have various physical symptoms. We've talked about loss of appetite, insomnia. We could even have loose stools or diarrhea, or even extreme cases of eczema. So, and again, people could even develop hypertension. So all various forms of, and in children, we know sometimes they might not even know what they're feeling. So they could talk of stomachache, they could talk of headache. So everybody experiences and feels and griefs differently. So various people will experience it differently. And I keep emphasizing, check out how you feel and find out why you're feeling that way. And then you could be able to find a solution through help.
Thank you very much. I move on to ask another question. Someone here is asking, as an association, what are you doing to help your members cope with mental health issues that arise during COVID-19 pandemic? I'll hand this to Prof. I'll also add in something, and Dr. Somba will also add in, Professor Atuoli, a bit of a history of physician wellness.
I mean, we started several years ago when at one of our annual general meetings, we decided as Kenya Medical Association that for a long time, the health of the practitioner had been sidelined. So we were focusing a lot more on our patients, but then we were not looking at the health of the doctors at the time. And so we formed, through our National Governing Council, we formed the Physician Health Committee, which had the responsibility of coordinating a response, a countrywide response through the divisions to ensure that the doctors who are members of KMA in those divisions remain healthy and remain safe to continue practicing medicine in a manner that ensures that they are safe. And one of the reasons why we did this was to avoid cases being escalated to the medical board at the time. So we would help colleagues before they make mistakes that would then lead them towards disciplinary measures at the board. So over time, slowly, we have been working, and the chair of that committee currently is Dr. Somba, who is here. And we have helped many of our colleagues who have had physical and mental health problems and substance-related problems to cope. So when this pandemic started, we quickly realized that one of the biggest needs is mental health and psychosocial support for our frontline workers. And since we had this infrastructure in place of the Physician Health Program Committee, we quickly asked the committee, with the able assistance of Dr. Joy, the Assistant Secretary General, to put together a program that would ensure that health workers first of all, come together regularly and share experiences and learn about mental health and how to cope, but also provides a platform through which people can get help when they need it. Because we know you will need help. If you're a frontline health worker, you will get tired, you will get stressed, you will get moral injury, you will start getting cynical, you will start wondering whether you're doing anything useful. And through this committee, we then collaborated with the Kenya Psychiatric Association and the Clinical Psychologists Association of Kenya, and together we put together teams that are available to provide support for our members. Joy, you can take it from there.
Thank you very much. I think Prof has laid it all out in terms of where we started off and the help that we are offering. We will, at the end of this session, we'll also share a number that anyone can reach us in terms of health workers for support. We've partnered with KPA and CPAK to be able to provide the help that is needed for health workers. And this is actually as a CSR from the 3 teams. And we hope that health workers can reach out and be helped as much as possible during this time. It's confidential as much as possible, and we will ensure that our health workers are as healthy as possible as they go on with their work. So we will ask the medical students who are with us to say hello. We've got the president of the Medical Students Association of Kenya, Nicholas Kioko, and Gloria, who is the chair of the mental health committee. They are doing quite a lot, though they are also having a lot of anxieties amongst them. So I welcome Nicholas. We have not yet made you daktari. Karibu sana, Nicholas.
Thank you so much, Dr. Joy, for this opportunity. And also, this is the first time that we are joining AKME webinar, and we are really delighted to be here and to just share our experience in terms of the medical students' perspective and the medical and the students in general. So the medical students is just like anyone else, facing various episodes of loss and grief, and these are related to the common causes of loss, such as those ones that Dr. Catherine has laid in her presentation, including loss of loved ones to this pandemic, loss of their family members who have been isolated in the isolation centers, as well as end of relationships, and this is something that we can all relate with in universities. So yeah, then inability to travel home. In fact, I have some of my friends who are still up to now unable to travel home, especially to come into Nairobi because of their lockdown of movement in and out of the city, and also lockdown of movement of in and out of the other counties, including Mombasa, and so forth. And there are those situations which specifically affect students and medical students specifically, including the stagnation of the academic programs and delay in graduation, and this also affects the future goals. And in fact, some of the students who are to graduate this year, last year, are still in school, and they have not even got into 6th year or into their final year, and there is a lot of delay in academics, and that is causing a lot of challenges. And in fact, this is making students experience various levels of grief. And apart from that, there is no hope of resumption of learning. And when attributing to the online classes, there is nothing much going on. Most of the universities do not have online classes. And actually, for the medical students, this is only applicable for the junior years, because for the senior years, even if you have online classes, then you will rotate for the same period when you go back. So there is no need of having such. And then the increasing cases of COVID-19 are making the situation of resumption of physical learning really difficult, because medicine is learned mostly by apprenticeship, and one must be there physically so that they can learn on the ground with the consultants and with the doctors in the various hospitals. And for this to go back to normal, there are so many public health measures which have to be put in place, including provision of the PPEs, including masks and all those things, because of course we need to interact directly with patients, and these are the part of the vulnerable population which needs to be protected, and also the medical students themselves need to be protected from contacting this disease. And then, so all these summed up together, they are attributed to a lot of cases of anxiety among medical students. In fact, there was a study done in China, which was looking at the psychological impact of COVID-19 pandemic on the medical, on the college students. And in fact, it found out that 24.9% of students in colleges experience anxiety because of this pandemic. And this is attributed to the delay in graduation and the stagnation in studies and so on. So these situations are really affecting students in different ways. And in fact, we can relate in the stages of grief, because different people and different students are in different stages of grief, all the way from denial to acceptance and the stage of growth. So, for example, if you can just log into your Twitter, you can see what is trending right now. The hashtag get finalist medical students back to school. So that stage of bargaining and trying to get the government to reopen medical institutions, and so that they can just finish, because most of them are tired of being in school and they just want to get out there and be done with medical school. So this is really affecting anyone, and does not discriminate whether you are a student or you are professional. It affects everyone. Thank you.
Thanks a lot, Nicholas. That actually opens a Pandora's of discussion. And I know if Prof is to be opened out to have this discussion go on, it will really take us a long way into the discussion. I can see Prof has unmuted his mic. And Nicholas, just know that support is here. We've got a whole team that's ready to support the students. I really loved what Gloria is doing within the mental health committee, supporting the students. I saw a poster on suicide webinar in a few days, but I leave it to Prof to say something. We look forward to having the institutions opened. As your patron, I will endeavor to ensure that we have that done as soon as possible.
No, I think our last statement from the COVID Response Advisory Committee that met last Wednesday, one of the items that we were advising on is the reopening of health training institutions with the appropriate protections in place. Rest assured that this week, on Thursday, we are speaking to the Senate committee, that is an ad hoc committee on COVID-19, and that is one of the things that we are going to be recommending again to the committee, so that they can then engage the ministries of health and education to see what needs to be put in place to ensure that health training institutions are reopened. In the meantime, wherever you are as a medical student, my advice from the other day stands when I had a webinar with you guys. Find a way of being useful, find a way of helping wherever you are. That is one way of dealing with, of coping with these stresses of this time. Don't worry too much about the things that are outside of your control. Worry more about those that you can control, and then go ahead and control them. That will reduce your stress. But then know that KMA is working very hard to ensure that your welfare is taken care of. Thank you.
Thank you very much, Prof. I know we have an obstetrician with us. We've got mothers who have lost babies during this time because of curfews, and they've been on lockdown and cannot access healthcare. Some are in border towns in terms of, like now that Nairobi is closed down, some are in the boundaries, and probably the health facilities inside Nairobi and access has been an issue. So I hand it over to Dr. Kigondu, our obstetrician in the team, to tell us the challenges they are facing as obstetricians in terms of grief and loss and how they are coping up as practitioners.
Thank you very much, Joy. COVID or not, mothers will continue delivering because pregnancy and delivery does not know whether there is COVID or not. Some of the measures that have been put in place may actually be detrimental to the health of both the mothers and the babies. And we have seen some places where mothers are afraid of going to hospital because of curfew, or there is no transport because of the measures put. And this can end up with loss of both the mother and the baby. And this has led to, may lead to a lot of post-traumatic stress disorder of the mothers, or grieving father. The fathers are often forgotten, especially if they lose the mother. And therefore, COVID-19 disease has actually increased these post-traumatic and a lot of grief. And we have a lot of grieving mothers. They may lose their babies for reasons related to this. And therefore, as obstetrician and gynecologists, we continue going to work, actually, and therefore increasing the risk of being exposed to both COVID, but we have to go far, and therefore we encourage governments and institutions to actually protect their medical officer interns, especially medical officers, and the specialists, especially in maternity, with provision of personal protective equipment, so that the mothers do not have a lot of grief, and also fathers who may lose their loved ones. Thanks.
Thank you very much, Dr. Kigondu. Yes, mothers are really suffering out there. In the rural places, traditional birth attendants have taken over. And yes, we are having an increase in maternal deaths, neonatal deaths. And this should not be the issue after all the gains that we have had, and has led to a lot of grieving in the community. So I hand back to Edith Kwoba. She's back. Sorry, she had lost her network. There's a lot of questions in terms of insomnia. And someone is asking, what do I advise a client who has been on sleeping pills and has had insomnia and now is working from home, and while working from home has been taking alcohol and recreational drugs to help him sleep, because even the normal sleeping pills are not helping. So what does this health worker do to help this person? I know working from home has made people have access to alcohol much easily, and it's getting worse. I hand this to Dr. Siengo.
Thank you, Dr. Joy. We know that insomnia is actually a condition we need to treat. And sometimes people think one has collapsed when we've stopped the treatment for insomnia. But the truth is it's not yet resolved. And we know that at times we need a thorough evaluation to make sure that we are actually not dealing with depression or another comorbid psychiatric disorder. Once we've started the basics of sleep hygiene, sticking to a specific sleeping time, making sure you don't watch anything stimulatory just before going to bed, making sure you're using the bedroom for sleep and not watching movies, no stimulants and coffee after late in the evening. Once we've done sleep hygiene and we've not resolved it, then we have to treat it because we know sleep is very important. And we know that there are various categories of what you start with, what you progress with, but even from sleep clinics abroad in the UK, for example, sleep clinics have established that there are people who have to be on treatment for insomnia for life. I know many doctors think that using hypnotics and other treatments for insomnia is, like you've just said from the question, but there's no treatment which is unhealthy if it's needed. It needs to be properly prescribed. Thank you.
Thank you. We've got Jean Jeptor who's asking, how can one deal with somewhat crippling fear of sudden loss of a loved one, especially through violent events such as car accidents and things of that nature? I hand it over to our psychologist. We've got Lisa Hemba, we've got Yvonne Orlando. Yvonne is already on, so take it.
Okay, first of all, I think from the psychological point, would like to maybe understand what triggered the fear, how long the fear has been, because once we understand what has been triggering the fear, it is easier to support so that the person resolves that fear. But if we do not get what is triggering it right now, and also what the fear exactly is, because we'll also want to find out if that fear was to come true, then how would the person react, what would change and all that. So we have to go back to basics. What triggered it? When did it start? What are the challenges it is bringing before we can now delve with the therapy? Because the therapy will be more to deal with the cause of the fear so that we can manage it. Thank you.
Thank you. There's a last question here. I know we can't be able to answer all questions, but anything that will need immediate focus, we'll ask our panelists and our speakers to be able to answer back on your emails. There is Hedrif Mohammed Hussein, who says, great discussion and thanks to the panelists for these inputs. My questions to Prof. Atwoli is, what does a successful grieving process look like? And is it fair to put a time frame to it, considering it's unique to everyone and one can act it out anyway? Then the second question still from Mohammed Hussein is, professionals in healthcare are exposed to continuous risk of patients, clients, on top of self-risk. On top of self-risk. So a follow-up to first question, how much does the therapeutic doctor-patient relationship contribute to the chance of healthcare professionals getting affected or having unresolved grief? How much human can the therapist, psychotherapist be while not losing professionalism?
Yeah, thank you, Joy. I just put up this, I hope it is showing.
Yes.
Yeah, so this is one of the ways that I conceptualize, like one of our colleagues, I think it was Yvonne, talked about the stages of grief based on Elizabeth Kubler-Ross's stages. And I conceptualize dealing with grief in this way, that depending on the stage at which a person is, there are some certain things you can do to help, and with certain outcomes that you'd like to have out of it. And remembering, again, as Yvonne said, that you can go back and forth, and I think Catherine said the same, you can go back and forth across the stages from denial to anger, bargaining back, or you can go straight down to depression and so on. So it is not a linear process. So you help a client based on where you find them. If you find somebody at a stage where there is anger, then they are communicating a need to express themselves, to express their anxiety in a safe environment, and then to start thinking about the things behind that anger and to find ways of redirecting that energy so that they can process the loss and incorporate it into memory, and so on. So if you find somebody at the stage of depression, you want to think about, do they just need a shoulder to lean on or to cry on? Do they need support in coping? So having somebody available and exploring what would happen after this loss is one way of providing support, but of course, keeping an eye open on the possibility of somebody going into clinical depression and therefore requiring treatment. So all these are ways in which you can deal with grief, help somebody start dealing with grief in order to reach a stage of acceptance where you are available to support them in the process of acceptance, to consolidate the lessons they have learned from this loss, to concretize their plans for the future and implement them in order to find meaning and to grow out of the loss and find something useful to say about the loss that they went through. So this is a way in which I conceptualize how one can deal with grief. On the follow-up question, I'm just finding it because it was, yeah, on the follow-up question about professionals being exposed to continuous risks of losing patients and clients on top of self-risk. How does the relationship contribute to chances of getting affected? Of course, we recognize that in all helping professions, whether it is in medicine, in nursing, in any, even in psychology, one of the risks is that you can get enmeshed in the problems that the patient brings, and they become a burden on you, and they increase your risk of developing psychological distress and even mental illness. And so one of the strategies that in all those helping professions we have been encouraged to do is to try and always maintain a therapeutic relationship and to be conscious that the relationship you're having with the patient is a therapeutic relationship. It is not a social friendship relationship, so that you are always conscious about your role and the fact that this person has come to you to seek help. So you can empathize without necessarily getting too involved in the emotions that are emanating from that situation. In addition, especially for the psychologists who have done this very well for many years, there's what we call supervision, where they are able to get another colleague to help them process the things that they have gone through as they help other people. And that is very helping, very useful. And I would recommend that in a time of a pandemic like this, when we have very many frontline health workers, the opportunity to debrief at least regularly is an important one. Even if you form a group where you share your emotions, share your feelings at the end of the day, and then look forward to what you're going to do the next day, that would be a useful way so that you don't go through the days accumulating these feelings, accumulating these experiences, and then they become a heavy burden on you. So it is important to maintain that professional recognition that I am the professional and this is a client seeking help. That is relatively protective. But when it does get through, finding a forum where you can share your experiences and learn from what other people are doing to deal with it, and find somebody who can provide coping support for you would be extremely important, especially in the context of this pandemic. I hope I've answered it, Joy.
Yes, thank you very much, Prof. And actually, you've opened out to our next webinar for next week. Next week, we want to have a webinar for our health workers in order to take them through what we will be conducting in the next few weeks. The team felt there was need for the group counseling sessions, and this will be done virtually because we feel the towns that are on the border and that are facing a lot of cases of COVID are expressing that they have not been sorted out in terms of their mental health issues. And we feel that we should start with something virtually since we cannot reach them and everyone is all over. So next week, the team will take us through highlights on psychosocial interventions for healthcare workers, how to log in into the virtual platforms, and how to be able to benefit from those virtual group counseling sessions. So we thank you so much for having logged on today. We thank the team of panelists. We thank the speakers. I'll hand over to my co-host, Edith Kwoba, to close this session and appreciate the team.
Thank you very, very much, Joy, for what you have done already. And I have a very simple job of first thanking in a very special way our speaker, Catherine Mutisia. We really thank you for reminding us about the different types of grief. And for me, one of the messages that I'm carrying home is that our feelings are valid. Whatever loss, it may look small to someone else, but it's valid. And that's a reflection of what we love, and that help is available. I think that's very, very important. Thank you to our panelists, like Professor Lukoya Tuoli. What I've carried home is what you said about planning, that if you plan, we get less anxious. Thank you to Yvonne. Thank you to Kyoko for reminding us not to forget the students, and we will hope to push as much as possible to make sure that schools reopen. Yes, we need more doctors in the field. And we want to thank everyone. I would not want to go through each of the names, but we really appreciate. And Kigondo, I shouldn't forget what Kigondo said, that we should not forget the men. You know, sometimes we think about the women so much when we talk about the distress and the pregnancy. Thank you, Kigondo, for reminding us as much. Thank you, Dr. Somba and our president and the whole KMA and CPAC and KPA for really making this work. We really appreciate that it's been going on well for several weeks. And we want also to thank our panelists. When I look at the numbers, I get amazed, just knowing that we are reaching so many people. And I believe that people are not just joining in for CPD points. I'm sure that it's making a difference. We really thank you for keeping us company and believing in us and believing that there's something good that we have to offer us again next week, so that we can make sure that at the end of the day, as healthcare workers, that if we don't die of COVID, we'll also not die of depression. We'll lose no one to suicide, and that we'll all remain standing at the end of it all. So thank you very much. We wish you a lovely evening, and we look forward to joining us and all of us having a great discussion next week. Thank you and have a lovely evening.
Thank you very much. Bye-bye.
Thank you. Goodbye, and have a good night and a nice week.
Good night.
Bye.
Bye. Thank you, everyone.
Bye. Goodbye.
Good night. Good night. Good night.
Bye.
Good night.
Good night.